I'd like to thank Fidelma for asking me to talk today and for her leadership as the leader of the CTN. So what I was asked to talk about was a little bit about the future of clinical trials and also some of the clinical trials we've participated in Ireland outside of the clinical trial network. But I thought maybe it's timely to reflect on how we've gotten to where we are in terms of clinical trials. And it's 100 years since the discovery of insulin. So those of you in diabetes will be well aware that it's 100 years since Banting and Best described insulin. They extracted it from the pancreas of dogs. And this is the first paper, or the paper presenting their work. And what it was essentially a clinical trial with an N of 1. So you can see the data here that they produced. And in the top is, Sorry, I was looking for the pointer. Laser. Yeah, okay. So on the top of the slide here is the glycosuria and the impact of the glycosuria. You can see the little black areas each time an extract was given. The middle panel is the effect on ketones in the urine, and the bottom panel is the impact on the blood glucose. So an N of 1 clinical trial showing a demonstrable significant effect on the diabetes in that individual. And this was the individual, and you can see the picture of him on the left, close to death, as would have happened had he not been treated with insulin at that time, and then 2 months later restored to health. So this was transformative for people with type 1 diabetes. But what became apparent afterwards was that we can control the blood sugar, but that's not the end of the story, and obviously complications can develop if the blood sugar is not adequately controlled. So it took another 70 years for the diabetes community to be able to show in a rigorous, large clinical trial of over 1,400 people that good control, intensive control of blood sugar in people with type 1 diabetes can delay or prevent the onset of the complications. And that really changed the way we managed diabetes, because up to then it was often managed with 2 injections a day. That trial used multiple daily injections and insulin pumps, and that's still the way we manage type 1 diabetes today. So it really was a trial that changed the course of diabetes management. Moving forward to the current century and type 2 diabetes, this was a very seminal study looking at diabetes prevention, demonstrating that type 2 diabetes could be delayed in its onset or prevented by intensive lifestyle management. And this presents a challenge to health services around the world, because it's not easy to implement these strategies in practice, and it's something I think we're thinking of in Ireland at the moment. Moving on, this was a meta-analysis produced in about 2008, looking at rosiglitazone, a medication that was used for type 2 diabetes at that time, demonstrating that although it was controlling the blood sugar, it appeared to increase the risk of myocardial infarctions. And so that led to the death of rosiglitazone as a drug, but also to a mandate from the Food and Drug Administration in the US to have all new drugs undergo clinical evaluations to ensure that they did not increase cardiovascular risk. We went ahead for 8 years, actually, and this study, the EMPA-REG outcome study, was one of those trials to determine that empagliflozin did not increase cardiovascular risk, but actually had the very unexpected finding that it reduced cardiovascular events, cardiovascular death, and heart failure admissions in people with type 2 diabetes. So this was backed up by subsequent studies with members of the same family of drugs, and this has radically changed how we manage type 2 diabetes today. So Ireland has contributed a lot to clinical trials over the years, and just a few of the trials that some of the members of our network have participated in. So this was a study, the Begin Bolus type 2 study of a novel insulin in people with type 2 diabetes. The Origin study, a study of early introduction of insulin in people with type 2 diabetes to determine whether or not it delayed cardiovascular events, and we had over 100 members of the population in Ireland participating in that trial. And then the LEADER trial, again, a landmark study demonstrating that GLP-1 analogues also reduce the risk of cardiovascular events. And again, some of our members participated in those studies. So there is a track record in Ireland for diabetes to happen outside the clinical trial network. So thinking ahead then to future trials, what are the unanswered questions in diabetes research? So I've put up prevention of diabetes. You've seen it can be prevented in type 2 diabetes, but how do we best do that? Should we be doing it with lifestyle interventions? Should we be using medication to do it? There's also the opportunity to prevent type 1 diabetes, and we're in the era of immunotherapy, where drugs targeting the immune system, either alone or in combination, can show promising benefits in terms of preserving beta cell function in people with type 1 diabetes. Studies that are not available in Ireland currently, but we'd really like to bring those trials to Ireland. Optimization of glycemic control in people with type 2 diabetes. So there's lots of new drugs in development coming down the line, and it's very important, I think, that we have the opportunity to make those available to people with diabetes in Ireland. And we are getting to the era of precision diabetes management, targeting the right treatment for the individual based on their phenotype, based on their biochemistry, or perhaps on their genetics. We need to move beyond just glycemic control in people with diabetes, think about other things that are important to the patient, such as their weight, and we do have treatments now that can help with that. Optimization of outcomes in diabetes and pregnancy, Prof. Dunn has already talked about that at some length, and prevention of complications, and Declan touched on that in the setting of diabetic foot ulcers. We can control the blood sugar well, and some people still develop complications. Why is that? We need to ask those questions. We need to be able to answer those questions and provide the treatments that best prevent the complications from developing. And Derek has also touched on the trials in new technology. You're all familiar with the clinical trial networks at this stage. I'm sure there are many in Ireland. Just some of them are mentioned on this slide here. And we're very excited that the Diabetes Clinical Trial Network is now launched. It's bringing together, as you've heard, healthcare professionals, scientists, and patients who have an interest in diabetes to help coordinate clinical trials in Ireland in the setting of diabetes. We have the expertise. We have a track record, as I've shown you, but that can all be enhanced by having the clinical trial network as an avenue for performing the research. And that will hopefully make state-of-the-art treatments available for our patients with diabetes, giving them earlier access to treatments that will help with their quality of life and help alter the course of their condition. Thank you very much.